agencies stepped in, and the church stepped in at the same time. So when they were doing writing over actions and stuff, they were just nice people, sit around, even talking about just people's homes. Nobody was doing it. There were people just stood around, going, yay, yay, yay. They asked the police department, kneel. You guys need to get down on your knees. I'm your servant, treat me right. I'm giving you and they did. And they calmed down. Nobody got hurt, nobody got killed. Yeah, when you work with let's look at this life.
I guess we're playing.
Did you see Bob was logged on?
Are you guys the only ones gonna be here? Oh.
So that's what I was. You need to type up a resume or something, submit it and write. Explain inside here, basically, but we need to upgrade. Somebody like me, that's right. Yeah, I know.
And then just explain it because it was, via Zoom, we're taking it on the fast.
We told. Everything.
Sure.
What I do is I get on the site.
What site?
It's like,
The site?
yeah, the site, the field research.
Oh.
Yeah, that's fine.
I'm
Being
just
a
looking
little
on
slower.
For, what do you check for? The link.
Democrat or Republican.
I don't know.
We used to have meetings and all sorts of.
We're live. We're just waiting for Supervisor.
Oh.
He's on his way.
Sorry. Mr. Howard, I just want to, I sent you an email, but there's nothing in the subject line. And I forwarded it to you.
Sounds good. No worries. It is 10:05. Welcome to the Delaware County Board of Supervisors meeting this day, August 10th, 2021. It's Tuesday. And go ahead and open our meeting. We did meet in closed session via Zoom today. As one of our members is, one of our members is away from the office right now. I do want to open up public comment on closed session items only. Normally we do this at 8:30, but since we're on Zoom, I'd like to do it now. So if there's any public comment on closed session items only, this is your time to make public comment on those items. Okay, seeing none, we're going to go ahead and start our regular session then and take a brief moment of reflection. Thank you. Kylie, please call roll.
Supervisor Hemmingson,
Here.
Supervisor Starkey,
Here.
Supervisor Short,
Here.
Supervisor Berkowitz. Here. Chair Howard.
Here. Supervisor Hemmingson, please lead us in the pledge of allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, any actions to report out of closed session? Thank you very much. Do we have any new employees to introduce to the supervisors today?
Yes, Chair, we do. This morning we have our Recreation Program Coordinator here to introduce our new Recreation Program Assistant.
Excellent. Yeah.
Yes.
Nice to be here. Thank you guys very much. And looking forward to doing a lot of fun.
Welcome. Welcome. Nice to meet you. Thanks for joining the team.
You bet. Thanks for having me.
Thank you, Kim. Thank you, Jim.
Any others? All right.
That's it.
Then at this time, I'd like to request any deletions, corrections, or additions from the board members to the agenda. Do we have any at this time? Okay. Seeing none, then we're going to go ahead and move on with brief reports from our board members or any county employee would like to give an update. So let's go ahead and start with Supervisor Starkey. Supervisor?
Thank you. So I did a lot in the last 2 weeks. I'm going to touch upon one, and I'm going to want to talk about COVID a little bit. I attended the local behavioral health board meeting. I got an update that the legacy is currently having 37 adults and 4 children housed there. There's a waiting list of 77 people. So the need is still there for more housing. The number of police calls have decreased in the past month, and the legacy is really collaborating with Crescent City PD to really even lower those call volumes more. The mobile shower program is up and running, and I just turned it on. And they serviced 63 people in the showers last month, and they offer showers once a week at the senior center, Tuesdays from 10 to 2. And the plan is to implement more as time goes on. They're hoping to partner with the Yurok tribe and other places within the county to have those several days a week. So real pleased with that. And then our after-hours mental health crisis calls have been steadily increasing, as we could probably have anticipated. So it's vital that the services that we use with the crisis support services of Alameda County continues. So very pleased to know that we have those things going on. Now, I just really want to, I know we're going to probably hear a lot about COVID today, and I just want to talk about it for the community. Is as of last night, we had 72 new cases from over the weekend. 9 new cases of incarcerated individuals. Our active case counts are 231. Currently, and this is the most shocking, we have 17 hospitalizations. So today we're going to appoint a new public health officer, but he should not be expected to come in and be the fix. As a community, we need to rally together and be the fix. We need to make sure that we're doing what we can to slow the spread. So I'm asking for all of us to do our share. I am going to ask again that our public health officer provide updates on every single agenda from now until November, because the projections are that we are in this for at least 2 months. So we need to buckle down and make sure we do our share. That's my report.
Thank you, Supervisor Starkey. Supervisor Short.
Sure.
Thank you, Chair. I contacted a Lake County supervisor in regard to a North Coast EMS issue. I attempted to resolve a constituent complaint about private property use. I attended a tri-agency meeting. I also attended the Behavioral Health Board meeting with Supervisor Starkey. And also attended the weekly COVID check-in that the manager, the operations manager at Del Norte Ambulance has reinstituted. Charles Tweed did a great job bringing us all together. At Pelican Bay, United Indian Health Services, Crescent City Skilled Nursing and Rehab, North Coast EMS, they all came together to report on their respective situations, morale of the groups, supply chains, any employee issues as it relates to our current COVID problem. And that's it for me. Transportation Commission and RCTA were canceled. So that is my report.
Thank you very much, Supervisor Short. Supervisor Hemmingson.
Yes, thank you, Chairman Howard. Yeah, I had a few meetings. I had a lot of discussion over AB 379, a discussion with staff and others at RCRC. And along with RCRC, Patrick Blacklock, who is the new president and CEO of RCRC, came to visit Del Norte County, met with CAO Lopez and myself, and I took him on a little tour after we had some discussions on some things that are really problematic for the county. One of those being our unfunded liabilities and PERS issues. So amongst other things, we had some good discussions. He's very knowledgeable. Is going to be a good fit for RCRC. We're very happy to have him there. At a proactive financial meeting, I had a call with Director Snow from Department of Health and Human Services. Had a Border Coast Regional Airport Authority meeting, which we were unable to secure a director. So we're still looking and going through transition. We'll have an item on the agenda later on to talk about that. And then I had a few conversations with constituents on some land issues, and hopefully we'll get those resolved. That's it for me.
Thank you,
Oh,
Supervisor.
I would like to say, as long as Supervisor Starkey brought it up about COVID, I agree. Do your part. You know, if you don't feel like you need to get vaccinated, then at least wear a mask. Do your social distancing. so everybody should do their part. If you can get vaccinated or feel like you could get vaccinated, then please do that. That seems to be the biggest defense in dealing with this disease. Have a good friend that didn't think he needed to get vaccinated, ended up in the hospital, and he is not in very good shape. So, and he's fairly young. So anyway, and we've got, as Supervisor Starkey said, we've got a lot of people in the hospital. They're getting overwhelmed. So do your part. Help me with my grandkids. I don't want my grandkids are not old enough to get vaccinated. So if somehow I end up getting it from someone else, even though I've been vaccinated and passing it on to them, I'm not going to feel very good. So I'm even trying to stay my distance there. So please do your part for the community. Thanks.
Thank you, Supervisor Hemmingson. Supervisor Berkowitz.
Thank you, Mr. Chairman. You know, I want to echo what Jerry said and what Supervisor Starkey said. We need to do our part. I've had a lot of contact with people who have had COVID. One of the things that they all agree on is, gee, I should have gotten vaccinated. If I'd have known then what I know now. Yeah, well, that's the problem. As far as my report is concerned, I had a chance to go to Klamath and meet with Mr. Crandall, the chairman of the Hunter Creek Services District. We discussed the procedure for turning over the ball field to the district. Also met with citizens who were concerned about the abandoned motorhomes and trailers in that area. Also had a meeting with Heather Snow, and we talked about the strategic planning. And I also attended the county fair, which was very successful this year, despite all of the problems. And that's my report, Mr. Chairman.
Thank you, Supervisor Berkowitz. Many of you know on Highway 199 at Elk Valley Crossroads has been a key issue of the Del Norte Local Transportation Commission now for well over a decade. Making progress with the California Department of Transportation and getting recognition of that intersection along with that corridor itself, Elk Valley Crossroad, in particular at Wonder Stump near Sunset High School, and in particular at Highway 101, all very dangerous crossings here in our community. It encompasses a massive, massive response rate. We had an accident last week involving a semi-tanker carrying fuel. It could have been pretty bad. We did have an hour-and-a-half plus road closure at that intersection, but it seems because of our model that we use here in the state of California, we just can't get this elevated without somebody dying. And that shouldn't be the standard. We've moved forward with projects on Timbers Boulevard and Highway 101 because that level of accidents at that location, especially since Dollar General has gone in, has now been elevated because it now presents a safety risk. Well, I wish there was a way we could be preventative instead of reactive to these problems. So the Del Norte Local Transportation Commission continues to actively work with Caltrans to try to make these improvements to very critical points that provide a great deal of confusion for our travelers and also our residents. But I'm making it my mission to get this moved forward and get it fixed because it is just a mess there. Had a phone call concerning an issue up in the Rowdy Creek Low Divide area with some shooting. I've forwarded the message on to the sheriff's department to see what they could do, as there was a sheriff's deputy involved with the issue. Unfortunately, I couldn't get back in contact with the constituent because after the 4-minute message, they left no phone number or way to contact them. So I'm oh, you are here. So this is good. Well, hopefully you'll make some mention of this today. In addition, attended a tri-agency meeting where we had some continued discussions concerning offshore wind power and attended agenda review. Similar to Jerry, we had a visit from the executive director of the California State Association of Counties, Graham Knaus, toured him throughout much of the county, really dialed in on local issues specific to last chance grade, Highway 101, interactions associated with our forest and fuels loads, giving him the perspective about our situation with public lands here, which we're close to 80% public lands and have been for a long time, and how we've discussed these huge issues, in my opinion, about conflicting state mandates through statute, which puts rural counties in the pinch we're in. We know with the fire safe regulations that were passed 2 years ago, we're in a huge pinch right now to even provide, if these fire safe regulations roll out as they are, to provide housing where there's housing and developable lots available on private land. This is a massive, massive issue. These issues used to be controlled by our county community development department. Now the state wants to take over the process, and it's a little sick. And then we've got the Coastal Commission on the coast side with sea level rise wanting to prevent development on coastal lands. So we're getting pinched, and we have state mandates to supply so many houses per year. It's a real challenge. There's ways through it, but it takes a lot of conversation. More importantly, it takes our lobbies like RCRC and CSAC to help have those conversations, and collectively as rural communities respond effectively to state statutes and prevent these kind of things from happening, and hopefully get amendments in there that work effectively for rural counties and especially Del Norte. Attended a proactive financial goals committee meeting, and in addition, talked to the state folks and federal folks here on the Forest Service about having some fire ready projects. There seems to be a lot of funding rolling down from the state right now about having fire safe ready projects. I know Supervisor Hemmingson on the collective that he sits on with the Forest Service, Smith River Alliance, and the tribes has done an incredible job at teeing up some of these projects. I put a request out to them to put a list of projects together so we could get some of the state funding flowing into our area, in particular to treat areas of high fire severity and danger around some of our large communities. And hopefully we could get some of those funds flowing as early as this summer and maybe this fall. As Supervisor Hemmingson mentioned, attended a BACRA meeting, the Border Coast Regional Airport Authority meeting, to address the staffing issue that we have there with the director's position. We did briefly address employments that continue to be on the rise, which is good. Looks like Contour is going to be able to stay with us as long as those employments continue to go up. Had some discussion, as Supervisor Berkowitz mentioned, on an item that's on our agenda today with Director Snow from Del Norte Health and Human Services. And then I do want to touch briefly on the issue that Supervisor Starkey brought up. We do all need to do our part. This is going to be a community effort to get this under control. When I hear pleas from our hospital in particular that they cannot handle the volume that's coming through there, it presents a massive problem to our community, not only to treat things that aren't COVID related, but also just to provide a service and enough beds so people aren't going to lose their life, bottom line. And so with 17 beds full there and a massive request from Del Norte County to bring extra resources up here to address that issue, we all have to do our part. And so thanks for bringing that forward, Valerie. And then as soon as our new health officer starts, we'll start having those reports on every board meeting. And lastly, I don't want to end on a negative note such as COVID, because there's a lot of positive going on in the world, and there's a lot of positive going on in Del Norte County. And I'll recognize Councilman Enscore, who's in our audience today. Appreciate you joining us here. As you're aware, this weekend, NBC on the Olympics played Kamome, and it had every bit of response to a story that our children started that we in Del Norte County and Crescent City could have hoped to have had. Within the first day of that playing nationally, we saw over 1.4 million unique views of web infrastructure that we set up to basically handle the traffic that we thought would occur from having over 30 million viewers to the Olympic Games. This is a positive thing for Del Norte County, and as many of you know, we've worked to have economic development activities here as we've lost a lot of our natural resource-based community, and tourism is one of those. But the the more important piece, besides this economic development, is how this community rallied, in particular our children, to return a small boat to a community that was devastated by natural disaster, that same disaster that hit our shores 9 hours later, but had the foresight to take that boat back to Japan and give that community a level of hope that has been unseen and unwitnessed in a long time in world relations. And that small little act of human relations, humanitarian, whatever you want to call it, was inspirational not only to this community and our students, but also to the world. And that is an incredible light that is now being focused on our small little town here in Crescent City and Del Norte County. Got to thank Councilman Enscore for helping to join us on this journey over the years and keeping that vision alive along with our students at Del Norte High School. So we'll go ahead and end right there unless there's going to be a report out from our CAO. Neil, anything today? Okay, well, it's just in time for public comment. So at this time, I'd like to go ahead and open it up for public comment. Members of the public may address the board on matters which are within the jurisdiction of the board. If you're addressing the board regarding a matter listed on the agenda, you may be asked to hold your comments till the board takes up that matter. Please limit your comments to 3 minutes or less. There's a timer right here next to you if you'd like to make public comments. So let's go ahead and get started. Welcome. Welcome back, I should say, to the non-Zoom
you.
meeting.
It's a pleasure to be in front of you all. Okay, so Linda Setter from the county. A couple of weeks ago, I saw an alert on my phone about a fire up Rowdy Creek Road, and so I drove up there, and the owner whose property was on fire was very distraught. And I happened to see Darren Short standing over there. And I said, well, you know, you should go talk to Darren Short because this guy's had problems with shootings and getting robbed and this, that, and the other. And I was shocked by what he said because he basically said that he thought this guy was a jerk and that Darren was unapproachable. And I think that's outrageous for a supervisor and a fireman. Maybe that's even a conflict of interest. I don't know. With that said, I'll go on to something else. 32 is the number of RVs that were parked along South Beach Road during the 4th of July weekend. And this is where you do 55-mile-an-hour speed limit. I think that's kind of a concern. 11 to 13 is the number of RVs, campers, or whatnot else that are parked there daily. And then 9 is the one number that is allowed to stay overnight, even though there's a sign that says it's in violation of law. You folks need to do something about that because I plan on calling Josh Levine today and filing a complaint. Recently, I've heard neighbors and some people that work at the Del Norte Juvenile Hall detention stating that they're getting inmates from the Del Norte jail and putting them in the detention with juveniles. And the workers there are concerned because they're not trained to handle unclassified inmates. They're trained for juveniles. So folks need to look into something like that. Finally, the Sheriff's Explorer program I'm very concerned about. I received a copy of a letter where there was allegations made against a sergeant deputy there. We have children in the Explorers program. You folks are aware of what I'm talking about. And I'm going to be damned if I'm going to have to start protecting kids work for the Sheriff's Department. So somebody better do something about that situation. Thank you.
Please.
Well, it's been quite an honor for a very long time, Bob. How are you? My name's Donald Morrison. I used to be part of the county back, I don't know how many years, Republican. Like to recognize that. Board members, thank you. I was listening to you developing a plan for this coronavirus 19. And one question I have, basically, in a plan like this is, will there be a permanent registry that people can go to check on if you have coronavirus 19 or if you're vaccinated? And secondly, what kind of protection can we put in place, like Linda says, for children and the community itself? So those are two main factors there that I'm really going to look into a lot for you guys. We dealt with this over in Medford. We had roughly about 219 cases, and all of them came out positive around fairs, they came around theaters, and they came out from parks where people are mostly gathered together. And I was thinking maybe you don't have to make it mandatory to wear a mask, say like out in the open, but if we were going to say like a closed environment where people are at, like here, we need some kind of protection. So I would think maybe we can make it mandatory for like a mask or something like that to come in. You know, we just can't have anybody just show up and say hi. And we don't know if they're vaccinated or not, unless they got proof, like Linda, she has a vaccination proof. But we need a registry. So that way the council could check on it, the police department could check on it, and the hospitals can have access to this file to help them understand the complexity of what took place. We have to narrow it down and go chase out who did what. It's too big. We're talking millions of people, wiped out millions of people. So Crescent City is a very unique place to have this type of program, but we need to kind of like critique it, you know, like make it really super, super good. And if we can develop something here, we can show it to other towns how to develop a plan for them to go about it. Nobody has plans. Medford didn't have plans. Jackson County doesn't have plans. Ashland doesn't have plans. Nobody has plans. I even checked up in DC, and DC says their hands are tied. They've done whatever they can. So basically, that's what I want to do. In my spare time, not that, you know, we're politically connected for a long time, so I would like to do that. Thank you.
Appreciate it. Thanks for your comments.
Hi, you guys. My name is Scott Bardsley, and I'm a new resident to your community here, and I bought myself 20 acres up on Low Divide. And for the 2 years that I've owned it, I've been robbed over a half a dozen times. I've been shot at a couple times. I've been shooting into my property more than once. I've found enough Sudafed caplets and packaging to more than likely completely cure a herd of elephants from sinus problems. So I don't think we have elephants here. I do think we have meth cookers. And it was on my property. So I've been harassed now for 2 years of violation of robbing me, shooting into my property. When I put a reward out for the fella, then he really robs me and burns my things up after he robs me. And now it's escalated to the point where I have people putting notes on my gate saying that they own the property and what the same heck am I doing on it? And once I respond to that note, the very next day, my property's on fire. And it was arson. I found out where it started. I found out it started with a BIC. I mean, it took common sense is all it took to figure it out. And what I'm asking of you guys, and I believe a solution that would save you guys a lot of money and ambulance response times and sheriff's response times. When I call a sheriff in this county and the sheriff tells me he's lost, he can't find me, I don't know what to think of that. I call him again and the same thing happens to me. I tell the sheriff, go back to your damn briefing in the morning, get the map out and tell people where I'm at. It never happened. The sheriff came to me and said, well, you can detain people. All you have to do is leave your gun in the holster. I didn't even have a gun. I tried to detain the person I thought started the fire, and I was subject to arrest for false imprisonment. And the man walked away. No plates on his vehicle, driving on our community highways illegally, and the sheriff's response was, it's not my job. My solution to this problem, and a very cost-effective solution, would be a satellite sheriff's building on my property. I'm willing to donate my land to you so that we can have an ambulance barn and a sheriff's barn on that, whether it's manned with volunteer sheriffs or what, but it would save you so much money and time if you had someone to direct all these people that are coming up like chickens with their heads cut off to try to find a broken leg, or to respond to a 911 that they never can find. So the solution for me would be to put the satellite building, whether it's an APCO unit or any of the sort, on the building so that I'm protected. And then I'd like to sit down with the council and talk to you guys about the experience I've had with one of your council members and the sheriff's department, the building department, the tax department. All have done things to me that are just completely ludicrous and not right. So I'd like to sit down in a private situation and say these things to you guys. And if I don't get help now, my family and I can't go back up. I can't take my grandkids back up there and physically say, you're going to be safe, because they're shooting into the property as they're driving by. And I need help now. I don't need it next week, next month. I need it today. I want to go back up today and feel, I'm a tree farmer, and I've got successful tree farms in Tuolumne County and in Calaveras County. One's almost 50 years old and one is about 30 years old. And the one that's 30 years old is actually California certified. And I would like to take this piece of property that's serpentine soil, which doesn't grow trees real well, and it's a mining site. And I clean up the mining sites because one of my previous properties was an abused mining site from our forefathers. And I clean them up, render them safe, get the shafts safe so the public isn't driving into them. We've had that happen here before, and render them safe at my cost. And what I'm asking you to do is help me with this, and help me immediately. I cannot go back up without being burnt out, shot at, or robbed. And I feel like, I'm retired from Alaska. I'm a pipeliner type of guy. I went up there. I'm born in California, and I went up there in the early 70s, and I brought my money back to this community, thinking that you guys, still got a fairly nice community, but
It's a great.
you're not patrolling it, and have an officer look at me and say, by golly, it's 12,000 square miles, and it's only one of me. When Calaveras County has satellite, sheriff's offices, Tuolumne County has satellites, and they're just as big. I mean, 12,000 square miles to me is nothing. A 5-mile driveway is nothing. They act as if, I'm out in the boonies so far that I'm, 18 minutes from an interstate highway, for crying out loud. And if I had my well, that fire wouldn't have been $1 million. I'd have had 5,000 gallons of water on my property, but I had so much problem with the building department. It took me 1.5 years just to get the permit for the well.
Thank you, Mr.
All right,
Bradley.
thank you. And I need help,
Can you
and I need it
please-
now.
Can you please, before you go, if it's before the end of the meeting, you leave your contact information with Kylie? Thank you. I appreciate it. Public comment.
Hi, my name is Dora, and my partner is Scott Bardsley. And I have grandchildren that I can't bring up on Rowdy Creek Road. And it's really a shame. I mean, we have dealt with so much up there. I'm asking that if you can't do what Scott has asked, then maybe get more officers, or get an officer for the Smith Rowdy Creek area. We need more law enforcement up there. It's just ridiculous. You've got ATVs up there. You've got all of this stuff going on, and people are just trashing the place, starting fires, doing whatever they want to do. And I don't understand why it takes so long for any kind of emergency call. And we were told by officers, take matters in your own hands. And I'll tell you, one told me, hey, if you feel that your life is threatened, then you need to do what you need to do and keep yourself safe. You shoot, because you don't have a chance with an AR-14. I'm shaking. I mean, I feel like, my life has been threatened up there. Scott's life has been threatened. And all he wanted to do was grow trees, and give them to people that needed them for, wildfires that, have been ravaging this country. But anyway, I just feel like, this county is a good county, and we do what we can to solve these problems. So I don't want to create any problems. I just want to have a peaceful life, and there's so much. I know you guys need so many officers, and really we need to have more funds for the police, not defund the police, fund the police so that we can get what we need. Because that's the only way, that we're going to be safe. If we can't defend ourselves, then we have to have somebody defend us, right? So there needs to be more officers. You cannot have 2 police officers for a 12,000 square mile area. It's ridiculous. Not only on Rowdy Creek, but you look at beachfront property. I mean, there's nothing but homeless people there. There's shootings. There's all kinds of stuff going on. We need more police in this area. And I'm just asking for that. Thank you.
Thank you for those comments. Okay, any other public comment at this time?
Chair, I have somebody raising their hand online and I also have a written. Which one would you like me to take first?
The written's fine, and then we'll go to the one online.
Okay. This one, I apologize if I pronounced the last name wrong, is from Carmen Hergenrader. And it says, respectfully, I ask you to not mandate vaccinations for county workers. I would like to work for the county and am well qualified. However, if you mandate vaccinations for county workers, I will not work for Del Norte County due to the fact that vaccines are not safe. Vaccinations are a violation of my right to be a free human. I refuse to inject myself, my son, and my unborn son with toxins that will degrade our immune systems. I will not allow my son to be experimented on, nor will I comply with any county mask mandate. Please have our back by shooting down this measure to force county employees to get vaccinated. Whatever happened to my right, my body? Do you think it is right to force someone to get an abortion? These vaccines can harm unborn children and possibly sterilize our next generation. Please protect our future by getting rid of the mask mandate in schools and not forcing our county employees to commit vaccine suicide. Respectfully and urgently, Carmen.
Thank you, Kyla.
And I have Mitch Hanna with his hand raised.
Please.
Mitch, you are on. You just need to unmute your mic.
Can you hear me?
We can.
Okay, yes, thank you. This is Mitch Hanna. I'm CEO at Sutter Coast Hospital and Sutter Auburn Faith Hospital. And I just wanted to make a brief statement in terms of the state of affairs at the hospital and what we're experiencing in the community with respect to COVID, and acknowledge and thank those supervisors who already made comment this morning with respect to the need to just be safe and mask and avoid large public gatherings. Sutter Coast is continuing to experience a surge of COVID patients needing hospitalization. We activated our surge plan, adjusting operations to support immediate patient needs. The hospital has temporarily postponed non-emergent surgeries, restricted visitors, converted space where needed, and are erecting 2 surge tents. We are coordinating with public agencies to help manage and reduce the census. And when I say reduce the census, I mean reduce the need for people to require hospitalization. And we appreciate the assistance provided by California Emergency Management Services Authority in supplying immediate staffing and equipment needs. We were literally on the phone with them on Friday evening at about 5:30 or 6, speaking about what equipment needs we have. And they had a truckload with everything we identified on hospital property by late afternoon on Saturday. So it was just really amazing to see. Their assistance has also enabled us to quickly deploy and staff on-site COVID testing and on-site vaccine clinic and an on-site area to administer monoclonal antibody infusions to treat clinically eligible patients. We're using the breadth of our integrated network within Sutter Health to support our dedicated staff and clinicians as they focus on providing the best possible care to patients. We especially thank SIMSA and the California Department of Public Health for their support and assistance to the residents of Del Norte County. In addition to the equipment, they have sent up quite a few personnel to help staff the clinics and the vaccination and testing site. Current case levels are driving some of the highest surge levels to date, requiring emergency response efforts. It's going to take all of us working together to reduce the spread of illness and slow down the rate of infection. We really need to be vigilant, wear a mask, practice good hand hygiene, avoid large gatherings, and get vaccinated. Vaccination against COVID-19 is still the most effective way to prevent serious illness and death from the virus. Our teams are equipped and highly trained, and our focus remains on serving our patients and prioritizing the safety of our committed staff and clinicians. As we manage the increase in hospitalizations, we're carefully monitoring the data and will continue to adjust our operations as needed. It is important that the public knows that the hospital is prepared for and is managing through the current surge in hospitalizations, and to come to the hospital for care if needed. And again, I just want to reiterate, we've erected or in the process of erecting a tent outside of one of our conference rooms that will be used for additional med-surg beds. We're in the process of erecting a tent by the emergency department entrance to triage patients. And what was our education training room in our community clinic behind the hospital is where the Emergency Medical Services Authority has set up a clinic for testing, as well as for vaccination, as well as for monoclonal antibody testing. So we're taking all those actions. We really appreciate the partnership, not only with SIMSA and the California Department of Public Health, but also with the county. And really want to acknowledge Kimmy Scott, who has been instrumental in connecting us with the state and helping to bring these resources to the county. So with that, and I know I mentioned this last week in a public statement with respect to public gatherings, and it's unfortunate that the fair was already planned, and I think that that train was too far down the track. But I suspect as a result of that, we are going to continue to see more cases come through the hospital. Right now, we have over 50% of our patients COVID positive within the hospital. And I'd be happy to answer any questions you might have.
No, I appreciate those comments. Mitch, thanks for joining us today and highlighting the severity of the situation in our county and Sutter Coast's capacity to help deal and manage the situation. We appreciate you highlighting our responsiveness through OES, and we will continue to assist you in any way possible as we get our heads around this here in the next day or two.
Thank you.
Really appreciate the service Sutter's providing. Okay. Kylie, any further public comment?
There's no more hands raised.
Okay, thank you. Then it's time I'd like to go ahead and move to item number 24, which is a timed item on our agenda for 10:30. Receive Department of Health and Human Services report, approve and authorize the chair to sign an agreement with the Collective Good to provide consultation services from June 1st, 2021 through July 31st, 2022 to not exceed $158,500 as requested by the Director of Health and Human Services and the County Administrative Officer. Ms. Snow, thanks for joining us today. Welcome.
Good morning, board. I think you all know this is, for me, been a much anticipated presentation, and I've been very eager to bring this contract to you. And I'm eager to get into a strategic planning process. I'm happy today to be joined by our Assistant Director, C. Tao, and we have with us Ellen Peterson from the Collective Good. So I have a PowerPoint.
You're up and running? Yep.
Okay. All right, so we will jump right in. You are familiar with undoubtedly Health and Human Services organizational chart and our structure. And of course, it's impossible for you to read any of these tiny little boxes, but it's just to convey the magnitude of our agency. And of course, at the very top there is the Board of Supervisors. So I report to you, and you have directed me to run this big agency. And so here I am trying to make some intentional plans and include you in that process. And
where are you at, Heather, on this? Just curious.
You're the very top little red box, and then I report to you. So I'm the second
so you're
one.
directly under there.
And then it's C. And then we have a very small little admin team and our reception. And then each different color is a different branch. You guys are familiar with our different branches. So
for the audience, please highlight those branches.
Yes. So the biggest one you can see from here, I don't know how it looks on everyone's computers, but it's a greenish color, is public assistance. I think maybe next we have social services, and then behavioral health, and then fiscal. but again, you can't see them. So that's my best guess from here based on the size.
Mental health is a distinct and separate department, or where does that fall into the structure?
All the branches all report to CNI. So
Okay.
there's behavioral health is a separate, I think it's the orange, but anyway.
Thank you, Heather.
And so really, I inherited this structure from previous directors. I've made over the 5 years that I've been here, a couple of tweaks here and there, but I have a feeling there are much bigger things I could do to make an impact. I think it would be valuable to look at other counties. I often talk to other directors and learn of positions they have that we don't have and think, oh, I wonder how that would fit in. And I've had a lot of ideas swirling around my head for 5 years, and it's time to call in some reserves and help me put together an intentional plan. So I want to know, what can we learn from other counties? And of course, just because it works in another county doesn't mean it will work for us. So I'm hoping that my experience from the 5 years and then the cumulative experience of all of our employees will help guide a process like that. So we have about 190 positions, and at any given time, we usually have about 170 employees. There's a normal rate of turnover and vacancies that we experience. We have a growing budget, and I was actually surprised to see the last time, this number is not in front of me every day. The last time I looked at what is our total budget, it was around 64 million. And this year our budget is 73.5 million. And about 16.5 is payroll. So we have, over the 5 years I've been here, I think our total budget has increased around 20 million. We've started a lot of new programs that increase can't be attributed to any one thing. It's a bunch of little things that have added up, and we're increasing programs and services left and right. And so we really need to respond by getting organized and being intentional with looking at our structure and those services. Let me see. Something else that you may not think about too much, we have every board agenda, several contracts we're bringing to you. These things don't just happen. It takes a lot of work and coordination and effort on our end, and we have really a team process to getting contracts, leases, MOUs, all of these documents that go through county council, they go through administration, we get input from a lot of people, we have revisions. These are the things that make our department function, and they're a lot of effort, and they have to be in place for this massively increased budget and all of these employees to function. It's like our inner workings. And so we have a small team, but with everything having grown exponentially, I would like to see if we can make some tweaks maybe to that area to address that. So here are the branches listed out for anyone not familiar with them. I tacked on the end there homelessness response because it really is a dedicated effort at this point. It's not, something that's just thrown in there. We're being intentional about that, and we'll look at how to be even more intentional. And I do want to touch on the pandemic. Due to the prolonged nature of this crisis, we've really had to rethink how we're existing on a day-to-day basis. Initially, we had to pull staff from DHHS department branches to help public health. And it was kind of this fluid thing that we figured out over time, where recently we returned those people to their regular duties, and now we're returning them back to beef up our response in public health. And so I don't know if there's any way we could have done that better. I think we're in a decent spot now where we have those staff trained, but it's certainly been a strain, not only on them, but on everybody else who's absorbing any of those duties. And I don't think we're able to perform our programs and services to the level that we normally would. But we're hanging in there. So I just wanted you guys to know the status with that and staff, because you've recently recognized those staff for their service. So why do we need a strategic plan? Well, I'm familiar with having strategic plans in a lot of the jobs that I've had and a lot of the agencies I've worked in. And I know a lot of you are familiar with strategic plans and have been a part of those and shared with me some values that you got from that. And I think the most important thing is to have intentional planning. We need a plan that will guide and motivate our agency on a clear path. And of course, in line with this quote from the World Health Organization, as Health and Human Services, we must have an inclusive approach that values diversity and equity. And so that has to be an essential way that we make our plan. And I'm going to pass it off to our assistant, C. Tao, for the presentation.
Good morning, everyone. Good morning, board. So I am going to go over the area of priorities that we'll be focusing on through this process. But first, I wanted to address the financials. How will this be funded? So 131,500 will be funded through DHHS funds, which are mostly state and federal dollars. The remaining $27,000 will come from the other county departments to cover the compensation analysis for their section. Oops, how do I go back? I went too far. I'm just talking now. So a big piece of this contract is the compensation analysis. You know, compensation really remains static. It's always changing because of the external market and what's going on with the economy, right? So salary survey data should really be gathered and reviewed every 2 to 3 years in order for us to make appropriate adjustments, right, based on what's going on out in the workforce. So the consistent use of salary survey then helps form a foundation for plans that are equitable and externally competitive. So, you know, dependable data is crucial to this process. So that's where the collective good comes in with their resources and their knowledge to help gather the necessary information. And the outcome is a comprehensive data set that ensures like a thorough understanding of the pay rates and the trends in the workforce within, you know, not just DHHS, but on a county level as well. Some of what will drive these conversations over the course of this work with the collective good is what's on the horizon for DHHS and the community as a whole. So I'll start with the behavioral health needs in the community. Crisis has increased over the last 3 years. We see that. It is predominantly occurring in the correctional facilities and within hospital ERs. As a response to the pandemic, the state has, you know, there's been conversations sparked in regards to public health reform and what that looks like for the future. And so, you know, while that's very unknown and we're still going through that currently, in hopes of working with the collective good and going through this strategic planning process, I hope that we're better prepared for what's to come. And then Heather touched on this earlier, but in the response to homelessness, you know, DHHS created a housing services manager last year, which is filled by Roy Jackson, who you guys all met in January of this year during a board meeting. And Roy is responsible for administering the programs and providing services to this vulnerable population. But we all know that it takes more than one person to do that. There's a lot going at the state level in regards to funding, and it's coming from all directions. The local housing division looks different for each community. We have to respond to what our local needs are and evaluate where housing and homelessness falls within the agency and the community. And so while I don't have it listed up here specifically on this slide, we're always also looking at how best to administer child welfare services, because that also remains a consistent challenge here within our community. And I also like to mention that the work we will be doing with the collective good is an investment. It's our largest investment is our employees. The cost of losing an employee to the competition due to, you know, outdated compensation is equally compelling. I like to highlight the statement. According to a study by the Society for Human Resources Management, the direct costs of employee turnover can be as much as 60% of the former employee's annual salary, and total cost can be as much as 200%. As Director Snow mentioned earlier, the department has about 15 to 25 recruitments running at one time. So it's really affecting us as a department. Our hope is to minimize turnover and increase employee morale. In a recent all-staff meeting, 100% of our participants agreed that a department planning process was needed in order to help us navigate changes and address systems to get us closer to our vision and our goals as an agency. And I'm gonna, share that, our goal is to provide services as efficiently and as intentionally as possible. And a way to do that is to then house all of our services in one location. So moving on to this next slide, you'll see that DHHS has several leases with a total annual income of, almost $674,000. If one day we're able to get to a place where we own our own building, we'd be making a good investment, a good long-term investment that not only builds equity, but there's stability there for us. So that concludes my piece. So I'd like to welcome Ellen Peterson from the Collective Good, who will share more about their organization and the scope of work that they'll be doing with us. Thank you.
Good morning,
Good morning.
Supervisors, Chairman. Thank you for the opportunity to speak to you today. We are the Collective Good. I am one of many representative of the Collective Good here. I wanted to share who we are. We're a consultancy based in the greater Washington, D.C. metro area. We are made up of a consortium of diverse consultants, diverse in identity and experience and geography. I myself am on the West Coast. I'm up in the Seattle, Washington area. And we represent a group. We come together to provide a data-driven approach to social impact organizations, whether they exist in the public space, the private space, whether they're nonprofits or they're B Corps, whatever that looks like. We have the breadth of experience to bring in the expertise needed to whatever space we step into. What we bring is a commitment to learning and progress and equity and inclusion. This is a core value for us, and we also bring a deep discovery process where we really dig in and get to know you and every aspect of you. We gather a lot of inputs, not only internally from staff, but externally from the community. We take all of these pieces and we will help you create a roadmap. So identifying where you want to go and where you are today and creating that roadmap of how to get there. So ultimately, our tagline is change the way you change the world, and that we stand by that and believe in that very strongly. So for this project, there is a team of 5 consultants. We have Ed Davies as project co-lead. He will be leading on the strategic planning, DEI, and the restorative work. Emily Rodriguez is the other co-lead, and she'll take the lead on talent assessment and the salary survey. I'm Ellen Peterson. I'll serve in an advisory role. I'll be supporting on strategic planning and the restorative work and also client relationship management. And then we also have another advisor, Britt Hogue. She's the founder of the Collective Good and will serve as a thought partner on this project. And Mayron Price, who is our project manager and accountability partner. So she will really keep us accountable to the deliverables we have promised in the work. So what can you expect from this process? So you can see there are many phases to this work. The ultimate output or outcome from this work is the plan. And to get there, we're starting with restorative work because it was identified through staff feedback to the director and the assistant director that there has been some problems in the past, issues that are some legacy cultural issues, and they're just getting in the way of moving forward. So we're going to go through a restorative process to really build trust, build community, and get the leadership team where they need to be to have a fully engaged movement forward, because their buy-in together collectively is critical to the success of this work. So that's where we're starting, and we're actually starting that this afternoon. The discovery process that's that deep dive of getting to know you. So it's a listening tour. It's a lot of interviews and focus groups. There may be some surveys and many conversations. We'll look at documentation, analyze data, do it all, and really get to know you. We will ask many questions. We may speak with some of you if you are willing and want to be involved in that process. Diversity, equity, inclusion, that is centered in every part of this work. So that is a core value for us. It has been identified as a core value for the department, and we keep that centered. So this will be integrated initially in the restorative work, but it is central. We never lose that. It's not a lens, it's just part of it. It's as a core value. Community input, we will be having 2 meetings open to the community. Those will happen in the fall. And so the details of which, as far as specific timing is yet to be determined, but we do want to have the opportunity for the community to participate in this process and hear their voice. And then the talent assessment and compensation analysis, you heard C refer to that somewhat. It is countywide, so it is all departments. We've worked with Neil on getting that set up. Emily Rodriguez will be leading that effort, and they've, I believe, already had one meeting to get that work. It will be getting comparable data from other counties. That includes their structures, so job descriptions, compensation, benefits. We're also going to be looking, especially for health and human services, at job descriptions. So the one-to-one relationship of job title may not be the same for that. And then all of that will lead to the strategic framework. So what this is identifying the vision. That's where you want to go. And that's important that the county understand, the department understand where it is, what that ideal future state is at the end of this plan. And then we identify the mission. That's the unique purpose and the work that the department does. And then we build priorities. That's what will it take to get there? What will it take to be successful? Under that are our goals. So these are our the changes really needed to be successful. And we have objectives, activities. So there's a structure that we'll be following that will output into this plan. And again, it's a highly inclusive process. It's a highly iterative process. So we'll get a lot of feedback rounds from partners and the staff and the community. So we're getting everyone's input, and every voice is heard and part of this process. And then implementation planning is really where the rubber hits the road. That's where you're assigning things to a timeline, tasks, ownership, et cetera, building in metrics, accountability, and then progress reporting. So with all of that, the question I will pose to you, obviously not to answer right at this moment, but is to think of how involved, how engaged you want to be in this process, and consider this an open invitation to dig in as deeply as you wish. And we would love for you to be a part of this. And then this is just your typical Gantt chart, just plotting this out along a timeline, just so you can see how the different phases of work align on the calendar. So we're starting today. That little tick is a meeting with the leadership team, and we're kicking off the restorative work today. And then we'll be moving into really deep dive into the restorative work and DEI in the fall, discovery work, talent assessments. Those will be happening concurrently this fall. And we'll really, in January after the first of the year, start working on the strategic framework. And again, highly iterative, optimized for engagement. So we really want to hear every voice. And then we should output the final plan. And what that looks like is we'll have a public-facing, easily consumable product that shares the vision and the mission and the priorities of the department and why, the logic behind that, how we got there, the community inputs, everything. And then we'll have an internal, highly detailed plan with all the activities, the owners, the timeline, the benchmarks, et cetera, et cetera. And then progress reporting on an ongoing basis for the duration of the plan. So that
is everything.
Great, thank you.
I guess as a closing statement, I would like to say, there's a lot that's going really well at DHHS. This is not in response to, wow, things are awful and we've got to, save it, right? There's a lot of things that are going really well. And I hope through this process, we can highlight and recognize those things. And then some of the issues that show up at board meetings that the board hears about, that we know are ongoing things that need attention, we can look more closely at those and bringing solutions. So the three of us are here to answer any questions you have. If you have questions about the countywide process that the CIO would like to answer, that's, I'll leave that to him as a separate part.
Yeah, thank you, Director Snow. I'm going to first open it up for public comment, and then we'll get back to any questions or comments from the board.
As always, the only thing I want to know is how much. Thank you.
The amount, so you're aware, is addressed right in the agenda 24 agenda item.
It's under agenda 24.
Yeah,
Yeah.
the amount is
Oh,
the amount.
was? I didn't see that.
Yeah, okay, please.
Come on.
Welcome.
Good morning. Norma Williams, Chapter President of the Donut County Employees Association, SEIU 10-1. Couple little surprises with this item that I wasn't aware of until now. Initially, Director Snow did approach the union about this item. We had some lengthy conversations and exchange of emails on it. I did express some concern based on past experience. I've been with public health since about 93. So I've been through all of the changes, especially when we made the move to 880. I saw what that entailed and how that failed in some respects when it came to employee involvement and employee input. Those were expressed to Director Snow, and she assured me that that would not be the case this time. And obviously, I took that into consideration. Obviously, a lot of what she has to do in regards to the department is under her purview under Article 1 of the contract. However, when it comes to wages, hours, and conditions of employment, which does include work environment, if there's going to be any major changes to work environment, any changes to duties, titles, the organization in of itself, that does involve the union in that aspect. That also would include the salary study. I've seen salary studies come and go. I've only seen one that I can recall way back in 98, 99 that was actually finally implemented. But others that have happened later on, those fell by the wayside. Finding out now that it's going to be a county-wide salary study is news to the union. And definitely, as I said, is a surprise. And again, when it comes to wages, hours, and conditions of employment, the union will need to be conferred and involved. With that, as it says, be that as it may, the union is supportive of what Director Snow has in mind. We discussed her vision and plan for the department, and that is what I'm addressing now. I think that as long, and I did tell her this, as long as Director Snow and her consulting team is open and transparent with the staff at DHHS, does not foster any false expectations, and actually includes what the staff recommends, all obviously within reason, then I don't see us having any issues with what she envisions. However, again, the union, I would like to at least have the union have a voice and be aware of what's going on. We will be carefully monitoring the process. We definitely want to know what's happening with the process. And yes, letting all staff know that the union will be available if there's any questions, issues, or concerns from any staff in regards to this process. So for now, we'll be carefully monitoring it, but we will give our support to the plan. And in terms of anything that involves countywide, obviously we'll be discussing that with your team. Thank you.
Thank you. Any other public comment at this time? Come on up. Yeah, go ahead, finish your time. You're
Okay.
at 2 minutes and 30 seconds probably.
Thank you. It won't take long. So this is supposed to cost $158,000.
That's
Now,
correct.
if we used a little common sense in our county as far as wages and stuff goes, we wouldn't need to spend $158,000 to have a group come in and tell us whatever they're going to tell us. And here's the thing. Harbor Freight is hiring people for $15.85 an hour. Now, I know that your county employees are making far less than that, and that's outrageous. We could save a whole lot of money by just doing a common sense move and giving these county workers a viable wage. Thank you.
Any other public comment? Very good. Let's go ahead and bring it back to the board. I'm not sure if board members have comments or questions at the time, but let's go ahead and open it up.
I only have one question with regard to Ms. Williams' statement, and Ms. Snow, you could perhaps answer that, is that we cannot change the structure of that wonderful diagram that you provided us that we couldn't see, but we know what it is. We can't change that without prior board approval, correct? Like, we can't just start adding positions, subtracting positions and that sort of thing. This is just a suggestion that will be coming from this.
I couldn't and I wouldn't want to, and I would not want the board to be surprised with any changes like that. Certainly not all positions are represented, and so there are different, considerations for different groups and then non-represented groups. But yes, any recommendation like that would come through, probably through the CAO and the budget process and ultimately come to the board.
Okay, thank you. I just wanted to just make sure that we were dotting i's and crossing t's. I do appreciate the thoroughness of this presentation on all three of your parts. That is very important when something comes to us to make a decision like this. So how thorough you were and the details that you provided us is appreciated.
Yeah, thanks. I certainly think if Director Snow needs this or seems to think that this is the direction that we need to go, I'm all supportive of it. It concerns me a little bit in that this whole thing, other than the talent assessment and the compensation analysis, it looks an awful lot like what we did with No Place Like Home. And because, or the process that we went through for the I think it was No Place Like Home. And that was a little bit less than satisfactory because we're in a rural area and that we don't have the numbers to really be able to implement a lot of this stuff. So I'm a little bit concerned on getting to the implementation process. And I'd like to, feel more secure and that we're actually going to implement something that we really need to do. That's a concern of mine. And the other thing was that you said there was going to be some sort of ongoing monitoring for the project term. What is the project term? Did I miss that someplace? Because I only saw the plan going out for a year.
So that's the development of the plan.
Right.
And so the exact term is whatever makes the most sense for the department. So that is an unknown variable right now. It may be 3 years, it may be 5 years, but it's in the development of the plan. The timeline is what makes the most sense for the department with what they want to accomplish.
But these costs are only for the development of the plan.
That's
These are not costs ongoing. I mean, this doesn't include ongoing monitoring later on, depending on that time frame.
That's correct. And fiscal feasibility is part of the planning process. It has to be reasonably affordable, right?
Please, Bob.
I was on the school board for about 12 years, and we went through 2 classifications and salary schedules. The studies were very comprehensive, And I think they shed a lot of light on what we really needed to know. So if this does that kind of thing, I think it's going to be beneficial and I would support it.
Yeah. Thank you for the presentation. Very well-rounded, informative in a short period of time. I do have some questions. I do have some comments. I do share Supervisor Hemmingson's concerns. And, plans are plans. Being able to implement the plans, that comes with a whole lot of resources. And whether we have those resources or not, I am glad to hear that part of the collective goods analysis is to really take a look at the feasibility of providing those resources to implement the plan. And there's no doubt in my mind the approach to really providing this inclusive process as stated is a good approach. It helps bring unity to a department when a department feels like they have no voice. That's great. But what I don't want to see come out of a process is a plan that we cannot implement. And that has to be number one, top of mind. And so a question I do have, this can't be your first rodeo in a small rural community such as Del Norte. Do you have an example of something like what you've done in a community our size, where you've rolled out an effective plan strategically? What did it look like at the end? So that's the question I have right now.
Yeah, thank you. Good question. So we have worked with other agencies, mostly on the East Coast, like Alexandria Housing, and but larger communities typically. This is our first rural county. That being said, we have experience personally. This is where the diversity of our collective comes to play, working with rural communities. Like I myself, through another consulting engagement, have worked with rural Stanwood, Washington, if you are familiar with that area. It is north of Everett, Washington. I'm getting blank stares. I won't explain why that is. But a very small community and working with their school district and operating within the constraints of a rural community that does not have a lot of resources, but wants to affect some pretty big systemic change.
Yeah, so I guess this is the crux of the matter, right? And your feasibility study should be able to play this out. It really addresses where we have been put at as far as small rural goes. There's no nothing that you'll hit on in the whole Department of Health and Human Services that is any different than what a large urban community experiences. We have all those same issues that a large urban community has, but we just have them at a different scale. But there's a difference with the availability of resources within those large urban areas that we just do not have. And I want to make sure that this is very well thought out as we proceed, that exactly what Supervisor Hemingson has been alluding to is very much top of mind in this process. Because I for one will be very disappointed if we get to the end of this process and there aren't components of this plan because of the lack of resources that we cannot implement. I feel a lot of what I've heard from the union making the statements today is important to recognize. But yeah, it comes with its set of challenges. So please, Supervisor Hemingson.
Yeah, first, I want to address the blank stares. It's hard not to have one when you're wearing a mask. But well, I think we all realize, the community realizes that the dynamics has changed. The homelessness issue, the mental health issues that plague our county, a rural county. I think that's where I see the need for this plan to come in, because I think things have changed. Yep. And I think we need to hit it from a different direction. I think Director Snow, I think, realizes that also. She's certainly much smarter than I am at these types of things. So I put a lot of faith in her, and this is what she needs. This is what the community needs. This is not a selfish thing in any way, that this is what the community needs. And I think that's the direction that I think we need to go. We need to find out. And I am concerned that having a one-time deal in a rural community makes you an expert, because I think you'll be an expert after you get done with Del Norte County, but hopefully not at our expense. Thank you.
Very good. Supervisor Starkey.
So one of the concerns that I think I've heard is that the progress along, is there any way that you could come and perhaps give us a 6-month update, kind of so that we know where we're at with what you're doing? Or is this one of those things where you need to have this at the end?
That's a great question. And one of those, the invitation to how involved you want to be, I think that's part of it as well, is what do you want to know? How often do you want to be updated, and how deeply do you want to be involved in this process? And it is an open invitation.
Yeah, and I would just to pile on to what Supervisor Starkey is saying, that not necessarily at a 6-month, but maybe at a benchmark, or as you get through one part of the project, that we get an update on those individual things. It might be 30 days or it might be 60 days. But whatever, whenever you go over a hurdle or you run into a problem, we would like to be informed of what's going on.
Absolutely.
So we want to be involved, I guess is what I'm saying.
Great.
We're seeing a positive indication of that from Director Snow. All right, well, we have a decision to make on the table. Oh,
Just
sorry,
say
Director.
you've got it. The last thing I would want is to come back in a year with a bunch of surprises that you think are wild and crazy. I would love if I can bring things back that you say, yeah, you talked about that 6 months ago and it's more developed now and it sounds good, and you told me how you're going to budget for it, or this thing that you can't do, but you're looking for the funding, and not be a surprise, and have your support in anticipation of that. And I would share that I have included Norma, the union president, in this. I apologize that she did not see that part of the contract that includes the full county, but it is in there for the public. And it is very important to me that we're transparent in this process. Everybody can see what the amount is funding. I do recognize it's a large amount of money. We're a huge department with a massive budget. And for me to be a responsible director leading it intentionally, I need a plan. Thank you.
Yep. Okay, we've had our opportunities. Let's go. Anybody have a motion for the board?
I'll make motion to approve and authorize the chair to sign an agreement with the Collective Good to provide consultation services from June 1st, 2021 through July 31st, 2022, not to exceed $158,500 as directed by the Director of Health and Human Services and the CAO.
Okay.
Second.
We have a motion second. Supervisor Berkowitz on the second. Please, Kylie. All right, please pull the vote.
Supervisor Hemmingson,
Yes.
Supervisor Short,
Yes.
Supervisor Berkowitz,
Yes.
Supervisor Starkey,
Yes.
Chair Howard.
Yes. All right, we're going to go ahead and take a brief recess for no less than 3-4 minutes. We'll be back.
No, I don't have a.
Okay, me and Cindy in the fire department, we all went around 13. Out here,
So what is your, I don't understand what you're. What do you want to do? I mean, do you want to vaccinate people? Is that what that's like?
Hang out. Okay.
I don't understand.
We had.
I'll get, yeah.
We went around and we lost.
So I don't get.
I
them to go through that plan and see what they can do.
Yeah. What's that got to do with this?
Same type of plan, same way. Thank you. Thanks for that. Appreciate you allowing us a brief recess, coming back into session. We're going to go ahead and move on with our regularly scheduled items under general government. Item number 25, authorize community development department to issue encroachment permits annually through 2030 for road closures associated with the Smith River Heritage Association, Smith River Days, the Tolowadini Nation's Indian Day Celebration, and the Yurok Tribes Salmon Festival as requested by the Assistant
Move to
County
approve.
Engineer.
I second it.
We have a motion second on the table. Public comment. Okay, seeing no public comment, we'll go ahead and bring it back to the board. Kylie?
Supervisor Short? I think you're muted.
Yeah,
There you go.
Yes, after unmute yourself. Thank you.
Supervisor Berkowitz?
Yes.
Supervisor Starkey?
Yes.
Supervisor Hemmingson?
Yes.
Chair Howard?
Yes. All right, let's go ahead and move on to budget transfer items. Approve and adopt budget transfer item 06-11 in the amount of $17,398 within the board's fiscal budget unit to cover payroll costs from 2020-2021. Approve and adopt transfer of 06-12 in the amount of $58,680 within the public health budget unit to reimburse other DHHS department for payroll accumulated by their staff assisting with the public health brand.
It's supposed to be branch, my bad.
Branch with contract tracing investigating as requested by department, by Director Snow. Approve and adopt transfer 06-14 in the amount of $1,175,000 within the public safety realignment budget unit to increase revenue and expense lines to reflect the funds year to date through June 2021 and expected revenues in July and August 2021.
Move for approval.
We have a motion on the table
Second.
and a second. Let's go ahead and open those to public comment. Okay, seeing none, we'll go ahead and bring it back to the board. Kylie, please pull the vote.
Supervisor Starkey?
Yes.
Supervisor Short?
Yes.
Supervisor Berkowitz?
Yes.
Supervisor Hemmingson?
Yes.
Chair Howard?
Yes. All right, not the last item, but let's just go ahead and discuss legislative and budget issues real quick. Consider miscellaneous items of legislative and budget matters pertinent to the county of Del Norte. Authorize the chair to sign and send appropriate letters with respect to matters pending before the state and federal governments. Neil, anything new to add under this line item? Otherwise, I'll go ahead and talk briefly on AB 379.
Nothing on today's meeting from me.
Okay, very good. Nothing on the federal side either to report out at this time from our discussions on Greg Burns' presentation?
No, I'm actually expecting him to get back to me with the presentation date for the next round for the American Rescue Plans. He's also going to be sending me an update on Senator Feinstein's request for the jail project.
Okay, very good. I appreciate that. We have, as you're aware, we had a long discussion concerning AB 379 at our last board meeting. That letter was signed and sent. Hopefully we'll be able to communicate with the author, Assemblyman Gallagher, soon on impacts to the state of California as it relates to AB 379. I know Sid with RCRC is doing his best to get that meeting set up, and appreciate Supervisor Hemmingson's continued diligence on this matter as we try to get it before it hits Senate appropriations. So thank you again for all your efforts there. Let's go ahead and then move forward with our last agenda item, in this case, our consent agenda. Do we have a motion on the consent agenda at this time?
I motion to approve the consent agenda.
Okay,
Second.
we have a motion and a second. Let's go ahead and open up for public comment on the consent and agenda items 1 through 22. All right, very good. We'll bring it back to the board. Kylie, can you please pull the vote on the consent agenda items?
Supervisor Short,
Yes.
Supervisor Hemmingson,
Yes, I need to recuse myself on items 4, 8, and 9. They are all customers of mine. I have conflict of interest.
Supervisor Berkowitz,
Yes.
Supervisor Starkey,
Yes.
Chair Howard.
Yes. All right. I appreciate you joining us both on Zoom and in person for this hybrid work we're doing as the county board. Look forward to having you all join us again at our last meeting in August. Until then, stay safe. Heed the public safety warnings